I would like to begin with thanking my friend, District 11A1 Governor Roshni Patel, for making the interviews you are about to see possible. Lions Kathy McAdams, Marie Pacelli, Sabrina Simmons, and Lion Daryl Rice took their time to educate me on a day I spent with them in Detroit. And we put these videos together to let you know and see what Lions are doing to assist those who are visually impaired. I'm going to begin with these.
Hi, I'm Lion Kathy McAdam. I'm with the Harper Woods Grosse Pointe Woods Lions Club.
And I'm Marie Pacini. I'm also with the Harper Woods Grosse Pointe Woods Lions.
And one of the projects that we have started is a district-wide project for 11A1 for introducing and recycling technology that is used for people who are blind or low vision. Both Marie and I are totally blind, but come from a little bit different backgrounds in terms of that. I had maybe, I'd say 2% vision in one eye growing up. So essentially blind, but I do know colors. And a lot of my learning of Braille and blind techniques came as a child. And Marie, your experience?
Yes, I never had perfect vision, but I did have a fair amount of vision as a kid, and I very gradually lost my vision over many, many years. So I really just kind of adjusted as I went along. And as I went along, I did learn Braille and some other skills of blindness.
I think you had a lot more experience with low vision than I did. And the technology that we recycle and people are interested in is often due to low vision. Different magnifiers, what we call closed circuit TVs that help you read on a screen and in much larger print. And you used one of those for work, didn't you?
Yes, I did.
Yeah. And so the recycling project was an idea we had because we know that a lot of people have items that they're no longer using. We also know they're old, but this is a free giveaway project. We do ask for an application, and we have a lot of Lions involved in helping us pick up items and deliver items. So it is a district-wide event. And we have been able to give away things that help people read their mail with a scanner that picks up the information and reads it out loud. As I said, the magnifying closed circuit TVs. Sometimes it's just a handheld lighted magnifier. Before the pandemic, we were able to have people come to a location and try things out to see if they would be helpful. And we always ask if they're involved with other programs so that we know if they are getting an advanced piece of equipment, if they need training, that would be possible. So it's been a little more challenging with the pandemic to do in-person things like that. But the group that is involved with this, we all have some training in technology and use of computers. We have not been able to do cell phones and computers as giveaways because that's much more complicated, and we want to be sure people are able to use what they get. And sometimes they're very simple things. It can be a watch, a talking clock, a calculator. I haven't had requests for a talking scale, but I think that's a very important piece of equipment, especially if someone is diabetic and needs to be monitoring their weight. We have not gone into any of the medical equipment, such as the glucometers, but we do know about them and let people know to ask people about those. And the other thing that we haven't done yet, but we're aware is important, is things for medication and being able to know what your medication is. So sometimes we're referring people back to programs in the area so they can get more information about more advanced items. Any other thoughts?
Yes, and some of this technology is very expensive. The closed circuit TVs can be thousands of dollars. And people are happy to donate things. A gentleman approached me on a bike ride actually and said his father had passed and he had a significant amount of this equipment and he wanted to know where to donate it. And he was just so happy that somebody else would be benefiting from the use of this equipment. And especially the magnification things for people with diabetes who are losing their vision. They can read labels. It's so important to read labels to find out ingredients, carb content, and that kind of thing. Anybody that's keeping a food diary would be very beneficial for that. So yeah, there's a lot of applications, and we definitely refer people for different equipment, like Kathy said, the glucometers and that kind of thing, to make management of diabetes easier. As we know, diabetes is a very serious condition, and the rates are increasing, and management on a daily basis is very important. And we feel our program is just in its infancy. We've been doing this for a couple of years now. We got a little slowed by the pandemic, but as our program grows, we definitely anticipate helping more people with low vision, and that will certainly impact visually impaired diabetics, as diabetes is a leading cause of blindness.
I think the only other thing I'd say is that we work very closely with the libraries for the blind in the area who get donations and didn't know what to do with the stuff they were getting. And they're glad to give it to somebody who can distribute it. And I do think this is a program that could be duplicated by other Lions Clubs. So thank you for inviting us to talk about it.
Yes, thank you.
Okay. So my name is Sabrina Simmons, and I'm a member of the Detroit Renaissance Lions Club. And there are several activities that the Detroit Renaissance Lions Club participate, one being a diabetic workshop. But moreover, personally, I'm the owner and an instructor for iLearn Technologies, where we learn to hear what others see. And here at iLearn, we attempt to improve the daily life of someone with no vision or low vision. And we do that with computers, Braille, some basic skills as far as cleaning and things of that nature here in the office. We'll even go home to a home site to do cooking, and so people can get an understanding of that they're able to accomplish things safely in blindness, along with orientation and mobility, so cane instruction on how to travel inside of this office and outside of the building on the street. Moreover, my favorite piece of technology is the iPhone. So I think back to 10 years ago when I had 20/20 vision, wore glasses just because I was on the computer a lot, and I was actually not even considering the use of an iPhone. I was an Android phone user, and then lost my sight, and I kept hearing it over and over again: get an iPhone, get an iPhone, get an iPhone. So I go to the store and I buy this iPhone, and found out that nobody at the retail store knew how to use it. And so I said, well, what do I have to do? I called up Apple and they said, turn on VoiceOver. Well, I turned on VoiceOver, which is a screen reader software that's used on the iPhone, and begin to flick. And it really opened up my world back to somewhat normalcy. I didn't have to have anybody make a phone call for me. I didn't have to have anybody go into my bank account for me. I didn't have to have anyone do anything for me on the iPhone. I could do it myself with the matter of a few flicks. And so that's what I began to do. And that fostered into me learning and beginning to teach others. And as I taught others, it fostered into me being able to manage my diabetes with an app called Freestyle Libra, where I can go on my phone and check my blood sugar without poking myself 4 times a day, and other things like that. Just about anything you could think of, from a voice memo recorder to again, a banking app, to maps where I can use the map to travel independently. Another app is Ira, where I can get personal help from a person with vision and travel through the airport by myself. I do and go by myself all the time. And in my doing and my going, I've truly learned independence simply from the use of technology. So you'll find me always with my iPhone and a power pack, so that I won't lose a charge, so that I can go forward and do all the things, not only that I need to do, but the things that I want to do.
Aren't they exceptional lions? After listening to these videos, I hope you have the beginning of an understanding of who we are serving as lions. It is important that we understand the relationship between diabetes and blindness and low vision. In 2010, 3.9 million adults with diabetes in the United States reported having a visual impairment, with 3.4 million projected to have vision-threatening diabetic retinopathy. Diabetes is the leading cause of new blindness for American adults between the ages of 20 and 74. The American Diabetes Association estimates that 12,000 to 24,000 people in the United States lose their vision to diabetic retinopathy each year. Vision disability is one of the top 10 disabilities among adults 18 years and older, and one of the most prevalent disabling conditions among children. Retinopathy is not the only eye disease associated with diabetes. Having diabetes also raises the risk of developing cataracts and glaucoma and several other eye conditions that can cause severe visual impairment. While in many cases, severe vision loss can be prevented through attention to blood glucose and blood pressure control, the sad reality is that many people with diabetes are living with significant visual impairment. However, life doesn't stop because of vision loss. And the good news is that there are many resources and tools to help people with visual impairment manage their diabetes and get on with their lives. Low vision and blindness agencies are available in every state. Physicians, diabetes educators, or other healthcare providers may offer the diabetic to assist the diabetic to low vision or blindness rehabilitation centers or agencies, or to occupational therapists, which will assist them with learning to use the remaining vision that they have, to learn non-visual techniques as necessary, and to remain as independent as possible, which each of these women demonstrated. Services offered by low vision and blindness agencies generally include instruction in daily activities such as cooking, cleaning, taking medications, identifying clothing, and shopping. Instruction also covers the use of adaptive devices lighting, magnifiers, and computers, as well as orientation and mobility training. Employment accommodations and training may also be offered, and individuals may learn to use Braille for their personal or professional purposes. It is important to understand usability and accessibility. Usability is the ease of use and learnability of a human-made object. The object of use can be a software application, website, book, tool, machine, process, or anything a human interacts with. Usability refers to how easy a website can be utilized. This has to do with Lai and Sabrina talking about using an Android phone versus an Apple phone because of software availability. Accessibility refers to the design of products, devices, services, or environments for people with disabilities. The concept of accessible design ensures both direct access and indirect access, meaning compatibility with a person's assistive technology, for example, computer screen readers. Accessibility deals with people being able to find and access equipment and resources. Because of the close relationship between diabetes and visual impairment, it is important that blood glucose meters are designed to be accessible to people who are visually impaired. Next slide. There are 5 or 6, I have on this slide 6, but we have the 6th one here. 6 criteria are spoken display data. As you put your blood onto the strip, it'll read what your blood sugar is. A high contrast, large font display. They used to be very small. Now it is very large numbers for those with low vision. Strip calibration that is accessible. Something that is more automatic. When you're using the same meter on a continual basis, you have to get it calibrated at times with different strips. An accessible operating manual. Something that is online that an iPhone could read. Accessible PC software such as screen reading and magnifying software. And portability, blood glucose sample size, and speed of processing the results. Next slide. Basic healthy living for the visually challenged diabetic brings several concerns to the forefront. Insulin administration, blood glucose testing, foot care, mobility, diet, mental health, and medicine supply management. I'm going to address just a few of these. Mobility is a big problem for visually impaired community, especially with type 2 diabetes. Because it is typically age and weight related, it impacts mobility even more. Those who are visually impaired tend not to be the most active. It's tough to get out and just go for a walk around a mall or just outside. Getting outside and being active decreases the need to rely on insulin or medications to manage their blood sugar. Certified orientation and mobility instructors are available to help someone who is visually impaired learn how to walk around safely with a white cane. Sabrina spoke of an application called Aria. This is an example of an application you can download on your phone and use whenever you need mobility assistance. There are live assistants that describe your path for you until you are at your destination. Or if you have any questions, I had a woman at the USA Canada Forum said she used it when she took her dog out when he went to the bathroom and she wanted to pick up his stuff. Cooking is a complex task for even those of us who can see, and maintaining a healthy diet and eating habits is critical for diabetes management. There are many adaptive tools and techniques available to assist those with visual impairments. A magnifier may be necessary for reading package labels or recipes. Some cooks may need cookbooks in large print or braille, or an audio cassette. Extra light or special task lighting in the kitchen may make cooking safer. And there are many specially made kitchen utensils that can make preparing and handling food easier for a person with low vision. Adaptive resources are a critical part of healthy living and diabetes management. Items such as blood glucose meters, diabetes applications on your phones, sharp containers and disposals, insulin pumps, insulin pen advantages, and the Libra, which Sabrina spoke of. It scans a sensor on your body and delivers to a meter, which is audible, but the audible in public is a privacy issue. Next slide. What are everyday resources and how can Lions serve? This list, of course, is not all inclusive, but shows items that Lions can assist those with visually impairments with. Items can be purchased and donated to clinics that serve diabetics or donated at health fairs. Telephones, the scales that Sabrina spoke of that will, say the number out loud. Thermometers, watches, computer programs, glucose logs, diabetic socks, insulin pens. The Prodigy dose, it's a way where you can measure, you can see what you're measuring by the feeling of the insulin around the shot. Fixed dose, which is less expensive than an insulin pen, and then lighting magnification, computer adaptations, writing aids, home safety items. All of these are items that you can make a service project out of and supply to clinics in your area. Building confidence in dealing with any disability is enhanced by having access to tools and resources that will assist you with your healthy living. Diabetes care team professionals know what areas the individual diabetic may be having difficulty with, so they can suggest resources or techniques that will assist them. With proper training and practice, people with diabetes and visual impairment can manage their diabetes and other daily activities in an independent, confident, and productive manner. Thank you so much for your attention this morning, and I am proud to serve as a Lion.
Thank you, District Governor Terry, and thank you to your video presenters too as well. That was very informative. We do have a couple questions from the gallery, and so I'm going to go right to those. First one is, what type of programs are available to determine the A1C or other tracking information to determine the potential for prediabetes as well as unknown cases of type 2 diabetes? Many do not know their condition until the disease has progressed to an extremely dangerous condition.
That is so true. What happens, what we are doing as Lions and through the DAD grant is we are having glucose readings at different events. So we can have a trained professional or trained Lion that can read, can do glucose testing, and that brings the blood sugar to someone that may not regularly test. Bring it to their attention. The A1C, we have done that at special events, and the Lions have also bought the Chelsea Hospital a instant A1C reader. It just takes a couple minutes. and you can get a reading right then. It's very important that we all have our A1Cs read on a very annual basis.
Thank you. Another question is, what things can Lions do to help juveniles with diabetes? Are there different challenges for the younger ones that have typically type 1 at that point versus adults that are, maybe weren't blind at the start, but had blindness later on or lost a limb due to diabetes? Is there other challenges or things that the Lions can do to help out juveniles with diabetes?
I am the mother of a type 1 diabetic, so I have been involved with the Juvenile Diabetes Research Foundation for over 20 years. Children with diabetes need their medical professionals, but they also need access out in the community to have fun and to adapt to their diabetes. We have walks Lions can participate in strides walks that bring awareness to the community and provides an exercise outlet for children. I really encourage everybody to work with medical professionals in their community and ask them, what can we do for the patients that you see? But definitely be involved. There is, all through the state of Michigan, there are JDRF events, and you are also available to do the Strides Walk, which there's all kinds of information on the LCI website.
Thank you. Those are some really good ideas. Another question coming in is, can anybody buy a glucose reader and test, even if they have not been diagnosed with diabetes? And what can people eat to lower their sugar levels?
One of the projects that we did in 11B1 that was promoted nationally and internationally was we made up glucometer kits. You can go to Walmart right today, and for under $20, you can get a meter, strips, and lancets and do your testing on a regular basis. If you're trying to do healthy living and watch your sugar, you can test yourself on a daily basis, whether you're a diabetic or not. There's instructions and online. The American Diabetes Association has excellent information. And it is very important that you go online and Google and talk to dietitians about what you can do to lower your blood sugars. You just have to really watch that sugar intake and exercise. The best thing you can do is drink water and exercise if you're a type 2 diabetic, and cut the sugar out of your diet.
Thank you.
I'll add this, through the DAD grant and the National Kidney Foundation, there are classes available that we can take as Lions for free. And on this program, it's 8 weeks, and we are learning, I'm taking it right now, we are learning all kinds of different foods that you can eat and still maintain healthy blood sugar levels.
I also took that class, and it was very informative and helped me to manage my eating habits and to lose some weight. And I do recommend it for any Lions. And as you said, Governor Terry, that it is free cost for the DAD class and that, right. And it's a great avenue for helping out with this. Having not seen any other questions at this time, I think I'd like to just wrap this up by saying thank you, Governor Terry, for a wonderful presentation. Thank you to your other video presenters as well. It's a very important topic. It's something that we can all do to help, Lions everywhere across the state and across the nation and the world to really help out in a devastating, disease that affects quite a few people, as you showed in your statistics. So thank you for a wonderful presentation, and appreciate your time.